Hello everyone, back again with another video. I'm changing up a little bit this time, a little different. This time I was joined by a select group of RNs. These are RNs, they're all represented underneath Bargaining Unit 17. They are health facility evaluator nurses, and their story, it's amazing. It's inspirational, and I'm very happy to be able to bring it to you guys. Enjoy. I'm so excited. I'm happy that you guys are joining me to tell your story. I've been following the HFEN situation, the struggle that you've had in order to gain the respect. And so the opportunity to tell your story is important to me, and to share that with other state workers, because at the end of the day, what binds us, what connects us, we all work for the state of California. We've all committed to become, civil servants. I'd like to introduce each of you and just tell me your name, where you work, and what it is that you do. And I'd like to start with Ron Rawson.
Ron Rawson, Health Facilities Evaluator Nurse, East Bay, CDPH, and we're surveyors. We go into facilities and basically enforce state and federal regulations as it pertains to healthcare facilities.
Same with Ron. My name is Abby. I am a surveyor. I work for the Los Angeles Monitoring Unit. We also do the same exact work. We go to facilities, we survey them, and we make sure that they follow state and federal regulations.
Hi, Tony. I'm Linda Martin, and I'm in Ventura County. I'm a health facility evaluator nurse, and like the other surveyors, we go to hospitals, clinics, convalescent homes, and we're the link that protects the patients and the moms and the grandpas and the grandparents in all these places.
Thank you.
Yes, my name is Darren James. Also a health facility evaluator nurse. I work out of the state facilities unit. So we cover the state hospitals such as Patton. We also cover prisons, the correctional treatment centers, and then our unit also covers the LA County hospitals. And that's pretty much, along the lines with everybody else, just a little bit different.
All right, thank you very much, Darren.
Hi, everybody. My name's Flo Stinger, and I am a health facilities evaluator nurse, also known as RN surveyor. And my job is to go out to the facilities, to the hospitals, and also skilled nursing facilities to administer state and federal regulation and make sure that the patients and the residents are receiving quality care.
Thank you. Pinky.
Oh, hi. So I'm also a health facility evaluator nurse, surveyor, same thing. We go to different kind of facilities from SNF, or nursing home, hospitals, ICF. So basically everything that what they said, that's our previous, or that's what we were doing.
Awesome, thank you. Bree.
Yes, good afternoon. Also a health facilities evaluator nurse with Los Angeles Monitoring Unit with Abby. We do the same thing. We also do initial licensing for facilities, home health agencies, CLIFs, and we do ESRDs for dialysis as well. Just like all the other HFENs, we also monitor LA HFENs for the SOSA process as well.
Awesome, thank you so much. Did I get everybody? I didn't want to miss anyone. So essentially, even though you're RNs, but my question for you, the first question is, and you got any one of you can take this. What happens when you go out to a place and you find that there's some things that are wrong? I know that there's obviously compliance is what you're looking for these operators, these facilities, you're actually looking to see that they're in compliance with state and or federal regulations. What happens when you find things that are wrong in these places?
There are times that when I've gone out on complaints, whether it be at hospitals or SNFs, and when I say SNFs, I mean skilled nursing facilities.
Mm-hmm.
And during the investigation, I found that there's a population that is wider than what we anticipated, which we would consider immediate jeopardy. And if that were to happen, just a simple complaint that a surveyor went out on to investigate could turn into a survey based upon the information that we were to find during the complaint. So if the population in the hospital is at risk in any way, it would be up to the surveyor to determine how much at risk they are, to call back to the district office and to run it by the supervisors, and at that point determine whether or not a survey would have to be done as a follow-up to the complaint.
What kind of issues would you, if there was a complaint, what are the type of complaints that you would actually be investigating in a facility?
Tony, so just to make it clear, the complaints, a lot of times the complaints we get are from it's the general population. So if there's someone that has a loved one that's in a convalescent home, for instance, and they feel that they're being mistreated, they're abused, they're being neglected, we're the life force that goes out there to investigate and find out if that's the case. The same in a hospital. If people have surgery and something goes wrong during surgery, even in cases when there's babies that die in hospitals, and everyday folk, they call the Department of Public Health and our department, and we're the ones that go out and investigate it.
So there's a known list of places that are problematic, right? It's not like, you just go in, you see what's going on, you report it, and then, they get a slap on the wrist. Those places are being tracked. Is that true? The worst places.
Yeah.
I guess the star system, right? The star system
Yeah.
we do, like the 1 star, 2 star, 3 star.
Yeah.
It's like a hotel. They rate them by stars,
Yeah.
And every district office probably has a list of agencies
Problematic.
that are problematic, and they know those agencies. We work in licensing and certification. So that's our main bread and butter. That's what we do for CHCQ, is our team of HFENs. We work in licensing and certification. So we're going out to facilities for their annual relicensing. And now for COVID, we're doing things like focused infection control surveys,
Right.
mitigation plan surveys, which is something that the state brought about. It's not a federal survey. So these are kind of things that we're doing in light of COVID. And the annual recertification process has been put on hold during COVID. So that's very important to note, that no one is going out looking at the entire facility. We're doing these focused surveys,
Okay.
looking at very specific things. And in the beginning of COVID, our direction was to play nice, to look for things, we're not there to beat up on the facility, but to make sure that they were in compliance with infection control related to COVID and any other infection process that we saw that wasn't working.
You guys, I'm glad you said that, because you just went right into exactly where I wanted to know, because COVID has touched everyone in every industry, and I wanted to know specifically how it affected you and the work that you all do.
Thank you for asking that, because a large part of how it affected us, and I say us as my colleagues in the beginning, was with no PPE to go out to these facilities. In the very beginning, I'd say April was when I first went to a facility, a COVID facility, with a mask that I had purchased. And when I spoke with my supervisor about, hey, we need better, because the mask I had was a surgical mask and an old N95 mask that I had, because I used to be a OR nurse before I worked for the state. So I happened to have some N95 masks that I had been fit tested for a long time ago when I was a much slimmer girl, you see. So, it's important to note that the fit testing of masks wasn't happening early on,
Right.
nor were we even getting N95 masks.
Right.
Yeah, so that is a very important thing to note. And when I went to my supervisor to say, hey, well, I've purchased these surgical masks myself, can I write this off on collalators to say? And it was like, no, you can't. And I was like, well, where is our help? Where are the masks, that we need to continue to do this work,
And this was, you said this was back in March.
This was the first time I really realized that I needed something stronger, was that facility I'm saying that I was sent to that was depopulating residents. There were COVID residents there that were in dire states. And we were sent in to figure out what's going on with with improper PPE.
Right.
And that was what saved us was the National Guard actually came out to help, and they had tons of PPE. And so I was able to do my job because of the National Guard, not because of my employer providing the proper PPE that I needed.
And we got those reports, and I'm very sorry to that happened, because I know that what we were asking you to do, and I just saw an email the other day where somebody was assigned to a facility to investigate a facility, and I think they had 83 active COVID infections in one facility. And when you're going to ask someone to do that type of work and put themselves in a position, and I don't have the numbers, but we know that we've lost some, first responders, medical people, nurses who were pretty healthy people, and they probably were exposed at work. And, I can't, thank you guys enough for just the work that you do, and for your colleagues, because people want to, do their job, and they want to be, as safe as possible while they do it. So the fact that you had to struggle for the PPE is difficult. And I hope that as we're speaking now, that issue has been addressed across the board. I don't have, the reports aren't coming in like they were, because I know that was an issue early on. As like you eloquently stated, it wasn't really, maybe pushed to get you guys the N95s or to do the fit testing. So hopefully.
No, it wasn't pushed at all, Tony, because in fact, as Bree knows, we were the ones that had to be our own advocates. We not only were sent into these facilities and told that we were going to be their infection control consultants, the ones that would be telling them what to do for infection control, but we were told we could do it with a simple surgical mask if we needed to, not the proper protection that we should be using, especially in places that have positive cases. But then we were also told we could go from, say, a positive facility to a negative facility to another positive facility, and there was no COVID testing for us. We required the facilities to COVID test their people every week, and they were on lockdown where they no visitation, nobody else other than staff were allowed to go in these places except for us.
Right.
And we weren't tested, we weren't given the proper PPE, and we were going from positive to negative to positive places.
Right.
And we were the ones that were advocating for our own selves because we didn't have the backing.
Yeah.
So for LA monitoring, one of the reasons why we noticed the difference with the PPEs, because like I said, we do go to LA County. And LA County, I don't know if everybody knows, has a different set of HFENs under county.
Right.
So when we go to the facilities, we would hear facilities say, so that's all you're gonna wear, which is maybe, if we're lucky, 1 N95 mask or a surgical mask. Apparently, we learned from these facilities that majority, if not all of the HFENs from county are suited up from head to toe, meaning they have their PPE, a surgical mask, a face shield, or
Shields.
and all these things. So that's one of, I mean, at least for me, it's a little like what everybody's saying. It's a little not fair because we're going in the same facilities.
Yes.
If they're suited up from head to toe, I believe we should be given the same thing.
So are you saying that as it stands currently that you still don't have the full-on protective equipment?
No, I mean, we do now.
You do
This
now,
was,
okay.
This was during the beginning
At
when
the
it first
beginning.
started. Yes, when it first
Okay.
started, we, at least for me, I found out that it was different by going to these facilities, and the facilities are the one who's actually saying, you're just going like that? Because the other lady came or the other guy came the other day, but they're like fully suited.
Right.
And I'm
Right.
like, oh, I mean, you can't badmouth anybody in front of the facility. So you just say, no, yeah, I'm good.
Right. Thank you for
And
that.
the other issue with that, Tony, is not only was it not protecting us, but we were potentially becoming super spreaders
There you go.
for the facilities we were going to, because we were not being tested for COVID. We were not being provided the proper PPE, and nobody else could go in these facilities except for us. And we pushed and we asked for the PPE. We asked to be tested. We were told that we could go get, if we wanted to get a test, we could go like the general population down to your local
To your
testing
own doctor.
facility and get your test if you wanted, which wasn't okay, especially because in convalescent homes, they literally wouldn't even allow the loved ones in there, and these people were dying by the droves.
Right. And there was some ambiguity as far as whether it was initially suspected that it was droplet, then it went to aerosol. Now it's just
Right. Right.
could be airborne.
Yeah.
So, not enough. Of course, this is a pandemic no one knew about. It mimicked SARS, but, it was different. And they didn't know. So as they went from droplet to it could be aerosol, could be airborne, it went from you don't need any mask when we were doing DSS consults to get a surgical mask to now you need an N95. And they still say, oh, if you're not in the patient care area, you can just wear a surgical mask, or in the green area or what have you. So, yeah.
One of the ways that we were able to get some resolution with it was to voice our concerns to SEIU as a group, as a whole. We organized in regards to our concerns about the PPE and what risks we were at as healthcare providers and what risk we were actually putting our residents and patients at by not having the appropriate PPE. That then triggered human resources and also the deputy director of our department to go ahead and consult with Cal OSHA. And Cal OSHA then started a respirator training program. And through that respirator training program, we watched a series of videos and took a written test on the correct fit testing, which is the fit testing of the mask so that it contours to your face in a way that there'd be no leakage for the virus to come in or out. And so it was through that organization with SEIU, with all of us combined, our peers, There's another group who was meeting with them in person and on conference calls. And we band together and we were successful in getting them to go ahead and abide by the guidelines to keep us safe and to also keep our residents and patients safe.